So today we're going to create a video about for our lymphedema audience. Okay, so let's say you have lymph nodes removal, or some of your lymph nodes here got removed in your left axilla or armpit. Okay, it happens most of the time. If you have breast cancer and you had a surgery, okay, so let's say mastectomy, and so when that happened, your surgeon will remove some of the lymph nodes. So over time, if you are not careful, so when that happens, you are prone to lymphedema, because our lymph nodes is our checkpoints. Okay, that's our filtering system. It filters, right? So you do not have, if you only have like one or two, you may get lucky that don't develop lymphedema. But if you have a few that's removed, and really need to be careful and constantly doing a manual lymphatic drainage at home to avoid that. Okay, so to do that, we are going to do some diaphragmatic breathing first, so at least 5 times. Okay, so inhale and exhale. So as I go inhale, I'm going to really focus in my stomach here, and I'm going to kind of like push my hands up, and then when I exhale, I follow it along. So we're gonna do 5 times on that. 1, 2, 3, actually 9. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9. So that is your diaphragmatic breathing. Okay, 9 times. And then we are going to do our cervical nodes. So do that one right there. So I do a lot of deep breathing in my lymphatic sessions, okay? Especially in the stomach area. So we do right here. It's actually just short neck. I just saw somebody there, so I was like, stop. So like that, and then right here above the clavicle. Okay, so you can do like that. You can stimulate it like 10 to 15 times, or 8 to 10 times. Okay, after that, I will go back to do my deep breathing at me. But before that, I will kind of like, do some work right here in the quadrant. Okay, so it's actually right here. Okay, and I'm going to start on the left side, and I'm going to start and then go to the right side. Okay, so it's like the angle of your hip bone, and then the angle of your rib cage right here, and it kind of like you start from top, and then your direction is actually going inward, okay, towards your stomach. All right, and then don't forget this right here in the middle, and then again, and then I will finish where I started. Okay, and then after that, I will do my breathing 9 times again. Okay, so it is letter M. Okay, so starts from your belly button like this, and then you end your belly button. So you cleared in this area, right? Now, if you are having issue here, you have swelling here, do you have 2 doors? Okay, you always have 2 doors: primary, secondary. Primary door, secondary door. So you always have 2 doors. So what am I talking about doors? So those are the area where we're going to drain our fluid from here, so we can release all the fluid that's built up there. It can't flow because we lose the filtering system there, right? That's why it's swollen. So we're gonna clear this area. Okay, and after that, we're gonna clear this area. Okay, clear this area. And after clearing that, we're going to create our anastomosis. So can do 10 to 15 times. We cleared. Now we clear this one too. So we're gonna start close to the nose. Okay, close to the nose. Clear, clear, clear. You have a hard time doing that, you can use your other hand. Okay, cleared. All right. So after clearing that, this fluid here, the arm, before I work my arm, I will actually start moving because I'm gonna really create the the connection here. Going to create. Okay, I'm clearing. It's jam right now. It's traffic, right? Then I can start treating. Okay, I can even do that. Okay, together. After this fluid here is built up. So what am I gonna do? I need to create a bridge, okay, a path. So this fluid here can move here and actually can be released. So I'm going to move this fluid here. So instead of going all the way there, I'll just go right here because I have lymph nodes here too, you know. So it's too far, so I'm just gonna go right here. Okay, I have nodes here. So create the path, clear, and after that, and always follow, always start proximal. Okay, so since like that, and then I'm going to, okay, the fluid bringing here. Okay, and after, then you can go ahead and drain all the way here, right here. Okay, or if you want, you can go all the way here. So after that, you're going to stimulate the nodes again. Stimulate the nodes, and then the cervical. Finish your breathing. The 9 times, okay? The letter M. And that's how you do it. You do it twice a day, morning and afternoon or evening, or you can do more. It's up to you if you have more time. This is Chris from Lymph in Motion, located at Cedar Park, your certified lymphedema therapist in Cedar Park, Texas. Thank you for watching.